whenever patients ask us about how to recognize stroke, we always emphasize what we call BEFAST. So BEFAST is B-E-F-A-S-T. So B stands for balance. If you notice a person suddenly falling or loses her balance, then you have to be aware that it's a possible stroke. E is for eyes. So if you see a patient complaining of sudden loss of vision, then that's also a sign. F is for face. So you recognize a person who suddenly has this drooping of the right side of the face, or the eyes become big, then you should, in just one side, then that is a possible warning sign of stroke. A is for arm. So arm is, for example, you see a patient who is unable to use the arm as strong as the other side. They may not be able to use a glass or drink water. There's some weakness, or whenever they start walking, the right arm seems falling, then that is already a sign of stroke. S is speech. So while talking to someone and you notice that the speech is slurred or he has difficulty expressing himself, that's also a sign. And T, the last part of the word, is time. So when you see these types of symptoms, you have to bring the patient immediately to the hospital, because as you know, there are medications that can actually reverse the stroke if the patient comes in within 4.5 hours. So that's always an emergency. Bring the patient to the emergency room, and always to a stroke-ready hospital. Because, in a stroke-ready hospital, you have a very good medication, the TPA, which can reverse a stroke, and you have good specialists, neurosurgeons, can actually remove a big clot in a large vessel of the brain. When we talk about ischemic stroke, it means there is a clot or blockage in one of the arteries of the brain. So these clots are actually made of either cholesterol or even parts of the blood, which we call platelets. So with time, if you damage a vessel, these platelets and this fat parts which are in our blood would start accumulating. And when that accumulates, it can cause blockage and lack of circulation to a certain part of the brain. So that is ischemic stroke. On the other hand, hemorrhage, like bleeding, is when a small vessel of the brain ruptures because of increased blood pressure. So that's more extensive in a way because you damage the tissues directly. So that's actually the difference between the two. When it comes to ischemic stroke, as I mentioned earlier, it's very much an emergency. If the patient can come in within 4.5 hours, we have medications that can possibly and most likely reverse the stroke. Or if not reverse a stroke, at least make sure that in the next few months, they will improve significantly. So that's number one, very important, you bring the patient to the hospital. Now, if they come in within more than that time or they are not eligible for that medication, ischemic stroke patients, because they have a clot that is blocking the artery, we give antiplatelets. Antiplatelets are medicines that actually prevent platelets from clotting or clogging the artery. We also have what we call statins, anti-cholesterol medications, which are now standard of care, and you have to give to patients with ischemic stroke. Now, for hemorrhage, that's quite different. So when a vessel ruptures, it really depends how big the blood clot is. So the blood in the brain, if it's small, we just give medications to lessen the pressure in the brain. But if it's a large one, then sometimes we really do have to do surgical management. So it's a very different thing. The other one is mostly medication. The other one is possibly surgical if it is large enough to cause an increased pressure in the brain.
There are actually modifiable and non-modifiable factors, risk factors for stroke. Now, those with family history has to contend with genetics. Also, other non-modifiable factors would be their gender and age. However, there are modifiable factors like change in lifestyle. Okay? We need to be very active, indulge in activities or regular exercises. And then also, we have to refrain from eating those food that would increase our cholesterol, would induce hypertension, would increase our salt intake. Okay? Also, refrain from drinking too much alcohol, refrain from smoking, and also do not use prohibited drugs. Okay? Now, having adequate sleep is also a very good factor in reducing stroke because sleep actually offers a way of having a good rest, and also we tend to recuperate well when we have adequate sleep. Also, they have found out that indulging in a lot of stressful activities would make us more prone to having stroke. So it's a matter of modifying your lifestyle so that you could reduce your chances of having stroke. Okay, it boils down to giving the best support, the much needed encouragement to those patients. We should take care of them by giving them their medicine on time and on the right dosage. Aside from that, we should allow the patient to have good rehabilitation. We can actually do the physical therapy ourselves as caregivers, or even afford some sort of massage. Now, also, we should assure our patients that even though they had a stroke, they could still have a good life, in the sense that they could still be productive in a way, and that we as family caregivers can accept what they happened and are willing to help them. Assurance is very vital.
Rehabilitation is very, very important in stroke patients. No? Right after a stroke, we advocate early rehabilitation. Rehab includes several modalities. We have physical therapy, occupational therapy, speech therapy, swallow therapy, and aphasia therapy. So for physical therapy, we have a subspecialist, a physical therapist who would come in to move your muscles, to try to strengthen those muscles again after a stroke, because stroke recovery does happen. No? So there are three components. There is the passive exercises, assisted active, wherein they assist you in moving your muscles, and then active exercises, wherein you move your muscles by yourself, volitionally. No? So the goal is towards assisted active and active exercises, because this stimulates neuroplasticity in your brain and helps in recovery of brain function. Then there is occupational therapy, wherein the therapist uses daily activities of living in order to promote therapy. So then there is occupational therapy, wherein the therapist uses activities, daily activities such as hanging up clothes, using hangers and putting up those hangers into a rod, or picking up, let's say, small marbles, putting them from one cup to the other. So these are activities that the occupational therapist uses in order to promote fine motor movement or large motor movements. No? There is also speech and swallowing therapy. So a speech therapist comes in to teach you how to, because your muscles of speech are affected, and even the swallowing, they have certain exercises to promote functioning of these muscles again. And then there is aphasia therapy. Aphasia is a language disturbance, so the patient has difficulty in expressing himself, or even in understanding or comprehension. So there are exercises also in order to help promote and improve these functions that are lost after a certain type of stroke. So again, early rehab is advocated, and the first 3 to 6 months are the most important months for rehabilitation, because we have a steeper or a better improvement within these months than if you do it a year from now or 2 years from now. So the first 3 to 6 months are very, very important in rehab med.